We continue our On the Hill team coverage. It's a product meant to be a way for sexual assault victims to collect DNA evidence without going to a police station or hospital.
And it may soon be banned in Utah. It's a legislative battle between people claiming to be fighting for the same cause. Fox 13's Max Roth joins us with a closer look. Max.
Yeah, thanks so much, Kelly and Bob. A company called Leda Health wants to make what they call self-use sexual assault kits. These kits have not been manufactured, let alone sold yet, but some of Utah's most prominent victims advocates worry that what's being sold is false hope.
I was sexually assaulted back in college. I unfortunately did not report.
Madison Campbell with Leda Health plans to make and sell at-home sexual assault kits. Currently, kits like these are free, but they're administered in Utah hospitals.
As a survivor, it really hits home. I also did not report, and I also did not get the kit done.
Tori Flint is a Utah victim advocate who says she would have used an at-home kit.
It's terrifying, and you feel like, and sometimes it's almost your fault is how you feel. Not that that's true at all.
In 2007, the Utah Commission for Criminal and Juvenile Justice said only 12% of sexual assault victims do report the crime to police. 87% never sought medical help. The problems are as clear as they are painful. But State Representative Angela Romero says something else is clear.
Why would anyone want to profit off of somebody's pain?
At-home sexual assault kits would do more harm than good, she says. Her bill, HB 168, would ban them.
It gives victims false hope that they can do it themselves when they need to be seeking out professional help.
She and Rape Recovery Center Executive Director Sonia Martinez-Ortiz say the kits will keep victims from help they need.
What we want them to do is get the necessary healthcare services available from a qualified sexual assault nurse examiner who is qualified to not just collect evidence, but to actually look for hidden injuries that a survivor may not be aware of or that you might not be able to see. And then again, those additional follow-up healing resources.
Also, they say kits administered by professionals stand up in court.
Anyone can get a free sexual assault kit if they've been a victim of sexual assault. And then there's a chain of evidence there. And even if they decide not to send it to law enforcement, that sexual assault kit will be stored for 50 years if they ever change their mind.
COVID-19 provided a test case in California. Restricted hospital access led to rape kits administered by professionals in victims' homes.
The district attorney went on record to say that there was no admissibility or chain of custody problems.
The debate in Utah is complicated by this online campaign against HB 168. Look up top. The tab for the website looks like it comes from the Rape Recovery Center. Leda Health owns the site. Same thing on texts opposing the bill.
It feels like this one particular company is just using misleading information to target folks who are in a very vulnerable spot.
It really looked like, oh, this is a Rape Recovery Center website. Oh, this is a text from the Rape Recovery Center.
If that happened, then that definitely was not meant to happen. I'm sure it was probably a mistake, but the things that we're trying to do is get Rape Recovery Center, Utah Coalition, and Representative Romero to hear our side of the story and to work together with us.
Campbell there says she wants to provide options, that the kits could be used in private, but a victim could have a witness remotely on something like Zoom, or they might help in parts of the world that don't have nearby medical services. Now, HB 168 already passed the House on Friday. It will now be considered by the Utah Senate. And by the way, the important thing everyone agrees on, please ask for help. Help is available, raperecoverycenter.org. They have a crisis line that's open 24/7, 801-467-7273, raperecoverycenter.org.